I have a question for my friend. I have a brother who came back to church, and he's anemic, and so he's been going in for treatments for that. But it's really been putting a load on his mind and other things, and it's caused problems with him and his family. So he was asking recently if a change in diet or something like that could help him to not have to go to the treatments, because he said it's just stressing him so much. He just wants to get
So
off.
what's the problem? Anemia?
Yeah, anemia.
Anemia. Let me tell you something interesting about anemia. With women, it's often heavy blood loss, which means a hormonal imbalance. But if there's not heavy blood loss, and it's a man who, of course, doesn't have heavy blood loss, it can be low hydrochloric acid, because iron is bound up in food, and it needs acid to free it from food. And so it's very important to strengthen the hydrochloric acid. I had a girl come with anemia, and they had her on antacids. She was only 25. I always say I have no authority over your medication, but this is what I would do. I'd stop that immediately, and we all put her on bitter herbs to boost her hydrochloric acid. But an easy way to boost hydrochloric acid is to drink a little bit of cayenne pepper, like a third of a teaspoon, and a little bit of, maybe third of a cup of hot water just before the meal. That really will wake up the hydrochloric acid. It's also important not to drink with meals, which waters it away. It's also important to leave a break between meals. And one sign that someone has low hydrochloric acid is it's 8 hours later and they feel like they've just eaten their meal. It's just not digesting. So we have found that lifestyle changes can certainly make a difference. And in my book, Sustain Me, I have a chapter on anemia.
Is everything you're saying about this true?
Well, there's a really easy way to test it. It's called the BHSC method. Because we need to test everything. The Bible says, prove all things in 1 Thessalonians 5:21. And do you know one of the best ways to prove it is to try it for yourself? And see the comment on anemia. I was anemic for 15 years, had several blood transfusions, was on iron tablets, and then I finally discovered through my own research I just had low hydrochloric acid. And it was low because I'd lived with an alcoholic and a drug addict, and stress had killed it. So I proved it. So you can prove it's true by proving it yourself, yes?
Is there a natural way to reduce the pain that comes with menstrual cycles?
Is there a natural way to reduce pain with menstrual cycles? Absolutely. And that is by applying the yam cream, because the pain with menstrual cycles is an indication of a hormonal imbalance. So once you balance the hormones with the yam cream, remember Psalm 104 verse 14, God gave herbs for the service of man. The yam cream is applied to the skin. The fat cells take up the actives from the herb and goes through the biochemical pathway that causes balance to come back in the hormones. So on the packet it tells you how, different places every day.
You were talking about eat breakfast you said like a prince, and then lunch like a pauper. But for people who like live active lifestyles, like work out, exercise every day, is there an opportunity where a third meal is necessary, especially if you feel like hungry at night when you're about to go to bed?
Absolutely. My boys are all tradesmen, so they're having breakfast about 6:30 in the morning. They're having lunch at midday, and they absolutely have an evening meal. So it depends. And when I'm in Fiji, we have breakfast at 9, we have lunch at 3. There's no evening meal there. So it's got to be something that works for you. But ideally, the lightest meal of the day is the third one, if a third one is taken.
A question, what if someone brushes their teeth twice a day, flosses, but still has bad breath and it could be either mouth, also in nasal.
Bad breath doesn't necessarily come from the teeth unless there's a bad tooth. And one of the worst dental procedures that can be done is a root canal filling. Because when a root canal filling is done, the nerve is taken out, so now you've got a dead tooth. And what the body often does is, as it always does with something dead, is try to push it out. And so abscesses can often build up behind the root canal. So I always ask if someone has bad breath, do you have a root canal? The other thing I look at is the colon habits, because especially when you wake up in the morning, the pyloric sphincter, which is the little valve at the bottom of the stomach, it's open. And so the fumes from down there come out. And so Dr. Kellogg said 3 intakes of food a day should equal, yes, 3 evacuations a day. So I would investigate those things if there's bad breath.
My question again about the yam cream that is recommended. Can you speak a little bit more about maybe conditions that one would benefit from, especially for females? And is eating like yams internally, like just eating them, does it have also a positive effect?
No, the eating of the yams doesn't have the same effect. Dr. John Lee, he's dead now, but he's the first doctor that blew the whistle on the problems that so many people have because of a hormonal imbalance. He showed that you lose most of the actives. Your liver detoxifies them so you don't get them. So applying to the skin is the most effective way. And in my book, Sustain Me, I have a whole section on it. And also online, you can Google Barbara O'Neill hormones and see a whole presentation on that. But there's a huge range of areas, from thyroid, osteoporosis, to fibroids, breast cancer, heavy periods, painful periods, insomnia, depression, anxiety. There's a huge range. This thing's big.
A friend of my wife, she sprained her wrist. I'm right here. She sprained her wrist, and she's an RN. And she says, is it better to use a Comfrey poultice or a cabbage poultice?
Well, that's a good question, and that's probably something many people ask. What do I do for my wrist? So what you do is you try cabbage one day, see what your wrist says to you. Do the Comfrey the next day, see what the wrist says to you. But they will do a similar thing. The cabbage gets the inflammation down, and the Comfrey gets the inflammation down. But the Comfrey has a growth stimulant in it, and it stimulates rapid healing, and its nickname is knit bone. And that's how I healed my broken radius so quickly, which surprised everyone. I did Comfrey poultices every day.
Hi, can you heal an umbilical hernia naturally without surgery?
Can you heal an umbilical? How old is the person?
44.
44. I healed mine naturally. One thing you've got to do is listen. So if you've got an umbilical hernia, you're not going to be lifting heavy weights. And by the way, the biggest muscle mass in the body is your quads, and the biggest bone in your body is your femur. And you know why? Because that's where we should lift. And you see how a 2-year-old picks up a ball? Got that? That's how they pick up the ball. How do adults pick up balls? And that weakens the back. So you've got to be careful on your lifting. And also, with an umbilical hernia, it's important to strengthen the core, but not irritate it. And only you will know that. Only you will know that. But you can put castor oil compress on there every night. You can even buy a brace that can hold it there. So give it a try.
What is your take on microdosing psilocybin mushrooms for mental health? for mental health? Things like addiction and anxiety and depression.
I feel that it's it's not a very safe area to do that. And there are so many things that are so much more effective and yet very safe. So regarding such mushrooms, I wouldn't touch them. But we have found with mental health that the first thing you do is you get them drinking more water, you get them exercising, plant-based diet, going to bed earlier. Because when all of those things are in place, the brain starts to work a little bit better. And also if they're coming off addictions, great to come to a place like this and do a detox, a couple of days on juices, the steam saunas, the walks. See, 1 week of a detox program like that, that's equal to 6 months on a good diet. That's pretty good. So that's where I would go.
Existence to be able to...
Well, what I find is, and I hear what you're saying, is that it takes 21 days to form a habit.
Yeah.
And our habits can be our best friends or our worst enemies.
Right.
And so just getting into the habit, even making an alarm clock. Right, it's time to drink my water. It's time to walk. It's time to start to get into the habit of doing things, because the body loves routine. It loves doing the same things at the same time every day. And so and no matter where I am, and I travel all over the world, you know what I do? I do the same things at the same time every day. And I think that's one of the reasons, other than implementing the Sustain Me principles, that allows me to do what I do. So write yourself out a program. It's really good for everyone to do this, and then do it. And remember, a just man falls 7 times and rises up again. So if you don't quite get it the next day, one day, we'll try again the next day. You'll get there.
I wanted to know what advice or counsel you could share with us concerning PCOS and how to manage it.
PCOS is polycystic ovarian syndrome, and polycystic ovarian syndrome is one of the many symptoms of a hormonal imbalance. So you can have 50 women with a hormonal imbalance. One will have fibroids, one will have endometriosis, one will have headaches, migraines with periods, one will have depression, one will have polycystic ovarian syndrome. Can you see what I'm saying? But it's all caused by one thing, a hormonal imbalance. Now, there can be many reasons why the hormones are out of balance. The good news is that the same thing really will fix them all. And that is starting to apply the yam cream. It should be applied for at least 1 year. It might have taken 20 years to get to this, but it won't take 20 years to undo, but it might take a year. And so, again, it's applying that yam cream, being consistent every day, 3 weeks a month, and that will get the balance back. But please watch my lecture or read it in my book, because I explain why. And there are many environmental poisons, especially the contraceptive pill, that have caused the hormones to go out of balance. And the hormone that's gone up high is estrogen, which causes cell proliferation. That's the growths. For one woman, it's endometriosis. For another woman, it's polycystic ovarian syndrome. For another woman, it's fibroids. Can you see what I'm saying? But the yam cream will balance it back.
You take your water in the morning. You have a little...
salt.
Yeah, the Celtic salt. Do you continue that all day long?
All day, yep.
Yeah. And since I go into surgery every morning, there's no way I could do like a half cup. So I do a liter first thing in the morning.
Yeah.
If I just put the salt in there to start with, would that help?
If you put the water, you see there's 3 magnesiums in the Celtic salt, and magnesium is a water-hungry molecule. So you put it in the water, it just dissolves in the water. But when you put it in your mouth, then your mucous membranes absorb it. It takes the magnesium to the cell, then you drink your water, and the magnesium pulls the water into the cell. So I have a little tiny container. I'm sure you could get a little container and put it in your pocket, have a little handbag or something. And my little grandchildren, they come up to my my bag and they open it and they find the salt. They put a little bit and then they go and drink their water. So where there's a will, there's a way. You'll find a way. The problem with drinking large amounts all at once is your body can't access it.
I know by experience that the body loves when things are done on time. Now, since you travel and you've been into many different areas, what do you do when the time changes? Do you change with it? Does your circadian rhythm be going for 6 months and it gets used to that? And then they change the time, and that does change the laws of the body. I'm thinking, do you change with that time?
Yes, I do. We live in an incredible body that has this inbuilt ability to adapt and adjust. So when I go to another country, I immediately go into their time frame. And what I found clicks my body clock over very quickly is sun. If I'm outside, I don't look at the sun, but I'll close my eyes and put my head straight up into the sun, maybe just for 10 seconds. Gets a bit boring otherwise. And then put my head down and maybe I'll garden, or if I've got a little grandbaby, I'll put the grandbaby on my knee, but I'll be outside in the sun, and those ultraviolet rays go through neurochemical pathways and reset the body clock. So I find when I go, say, from Australia to America, that's the biggest change, that I might have one night where I wake at 2 a.m. Only one night. And that's quite remarkable, because I've met people who are still got jet lag weeks later. And you know what they do? They sleep in the day. If you sleep in the day, you're never going to sleep at night. And then they say, but I get tired. I say, well, go and have a cold shower. Get up, talk to someone. But if you can just make yourself stay awake until that night, I find that my body adjusts very quickly.
My question is, can you repeat the whooping cough formula that you shared? Right over here.
The whooping cough formula.
Yes.
Well, on YouTube, there's a lecture of mine on poultices, and you can see me demonstrate them, or in my book, Sustain Me, I've got the chapter on it. With whooping cough, it's called the 100-day cough. Now, usually it's only severe for a couple of weeks, but there will be coughing for a while. But what I have found, a couple of things, is finely sliced garlic on the bottom of the feet, but the garlic must never touch the skin. You put a cloth between it, and then you put it on while the child sleeps, and give them plantain tea. So the plantain's growing everywhere around here. It's also called ribwort. So it basically looks like that. And it's got these ribs. And you can also get, and the seed head basically looks like that. And then you can get narrow leaf plantain, where the leaf is very narrow and it's got the ribs, but its seed head has just got a little seed head like that. It's growing everywhere. You see it on the side of the road.
How does the mineral content of Celtic salt differ or the same as sea vegetables? And is there concern for the small levels of heavy metals in sea vegetables, such as arsenic and cadmium? Is that a concern?
Yes, that is true. The sea vegetables can take up the heavy metals and the minerals. The heavy metals. But the seawater doesn't, because the heavy metals sink to the bottom of the sea. And so that's where the vegetables taken up, the seaweeds, and the little fish feed on that, then the bigger fish feed on that. And mercury is bioaccumulative, so the bigger the fish, the more the accumulation. But it's not in the salts, because it sinks to the bottom of the sea.
I have a friend, and she said she went to the doctor, and they found a mass on her right kidney. She put poultice, compress with Comfrey. And she said that castor oil. And she said that for 2 months that it kept growing. Now it's 2 inches, 2 more centimeters bigger. So what can she do?
Do you know what my question always is why did she go to the doctor? Why did she have a scan? See, there might be cysts on my kidneys and on my liver, but I'll never know. See, I think if there's a problem, your body will tell you. And sometimes when someone has a test, now fear comes in. So my question always is, when people say, I've got this or I've this, you know, the labels they give you, you know what I always ask? What are your symptoms? What are your symptoms? So maybe there was kidney pain and that's why she went to the doctor and that's why she had the scan. I don't know, but so I'd be looking at the symptoms. What are the symptoms? And I'd also investigate, does she drink adequate water? You can take kidney herbs. There's a whole chapter in my book on the kidneys where I look at the herbs and I give the story of a lady who was about to go on dialysis. She came to our retreat, implemented the herbs and the lifestyle and did not need to go on dialysis. So there are so many other factors, but keep doing the castor oil.
I have a question on rheumatoid arthritis. So is there anything that you can do about it? Because my mother had it, and it's been in the family, and my sister has it, and now they want to give her this medicine, and it's really bad.
Yep.
So is there something
Well,
she can do? Because her bones are
absolutely.
She's in so much pain.
Absolutely. I just want to make a statement right now that I don't believe in autoimmune diseases. Do you hear that? Because I see people totally heal. And God didn't design the body to eat itself. But when someone's given this label, that's why reject the labels, reject them. What you listen for is your symptoms. And my book, Sustain Me, covers a whole lot of things where you start applying things because drugs will never heal disease. And so if someone has rheumatoid arthritis, we first look at the symptoms. Let's say the wrist is painful. Well, for a painful, inflamed wrist, ginger poultices can take the inflammation out. But if there's a lot of inflammation in there and you put a ginger poultice on, the skin can get very hot. So you might only do it for a couple of hours or even an hour. And then overnight you wear a castor oil compress on the wrist. So my mother was a cripple in a wheelchair, deformed with rheumatoid arthritis. So I have strong inherited genes there. She died at the age of 51, a cripple. You've probably noticed that I'm not dead and I'm way past 51 and I'm not in a wheelchair. But what was interesting is before I broke my wrist, this thumb used to hurt. And so I just started wearing a castor oil compress on it every night and then it didn't hurt. So when I broke my wrist, I said to the doctor, this is after 4 weeks when they did another x-ray and saw that everything had healed, I said, is there something happening in the bottom of that thumb? He said, oh yeah, you got a bit of osteoarthritis there. And I thought, and I suspected it was something like that. And then some would say, Barbara, how could you have? Look at the way you live, arthritis. Well, my mother was a cripple in a wheelchair and died at 51. And if at the age of 70, all I've got's that little bit there, praise God. And everyone I know is managing something. And if you can manage it, you're doing well. So in my book, Sustain Me, there's a whole program for arthritis. So this morning, one of our cooks, I went in and her hand's in ice water. And so I said, what happened? Burn? Yes. So I ran up to my room and I got some cloths because I always travel with some cloths that I can use for poultices, had a bandage, and I made a saturated Epsom salt solution. I was hoping to find aloe vera, but we couldn't find any. And so what I did was I made a saturated solution of Epsom salts. And how you make that is You put a bit of Epsom salts in some water, stir it till it dissolves. Put a bit more in, and you keep putting in till it won't dissolve anymore. I folded this cloth up to fit here, put it in it, wrung it not tight, you want it quite moist, laid it on the area, put some plastic over just that area, and then I had my bandage that I bandage my wrist up every night in, and asked God to bless it. I said, how's your pain? She said, 8 out of 10. I said, yeah, it will be, but it'll settle down. So 20 minutes later, I went back. I said, what are your pain levels? She said, 6 out of 10. 2 hours later, I said, what are your pain levels? She said, I'm only 2 out of 10 now. So that was just today. So notice what I had in my suitcase. Some rags that I can make poultices with and an ace bandage. That's why always try and have these things with you. And how simple is that?